For my root cause analysis, I composed a fishbone diagram with the factors of people, methods, materials, environment, and equipment as those factors that are impacting of the hospital readmission within 30 days post-discharge. The people aspect of it I put down is for the primary care provider, the hospitalist, the nurse, and the case manager. The reason why I added those people in there, and then also the patient and the caregiver, is because the primary issue with the discharges is the lack of follow-up with the primary care provider by the patient. And then sometimes the patient and the caregiver are made aware that they need to make an appointment and they forget to schedule the appointment, so they end up not following up within the timely manner that they're supposed to. And then also for the methods of discharges, I put the discharge process and the follow-up process, because the discharge process, as I said, can be very rushed because they're in a hurry to move patients in order to bring patients up from the ER. So it's kind of a fast process, and the patient doesn't have time to really think about and absorb the information that they're receiving from the doctors. And the nurse has a minimum amount of time as well to speak to them, because they have their other patients that they're taking care of, and we have a limited amount of time that we have to get the discharges done. I know for my facility, they like to have our discharges done at least within an hour or two of getting the information. And then another issue with the methods is appointment scheduling, because oftentimes the patients are supposed to have follow-up appointments within like a week of their discharge, but sometimes because the doctors are overwhelmed with their patient load, it's hard for the patient to be seen by the doctor. Sometimes you're not getting appointments till a month out. I know I myself personally have been through this, where I've been in the ER for a hospital visit, and when I left the ER, I was supposed to follow up with my primary care provider, but I couldn't get an appointment for at least a month. And what kind of early discharge follow-up is that when you can't get an appointment with your primary care provider? You have to see somebody who's not your primary care provider, so they don't really know your health history. And then also for materials wise, I indicated that discharge paperwork, prescriptions and medications, and DME is also a problem within the equipment sector. The reason why I added this is because the discharge paperwork can be complicated, and sometimes it's not in the language that is known to the patient, because I know in my facility the discharge paperwork we have is basically in Spanish and English, and it's difficult to get it in the patient's primary language if it's not English or Spanish. And sometimes if it does print in their language, there's certain parts of it that automatically continue to print in English no matter what you do. And then also I put as another issue and the environment, which is the location of the primary care provider's office, transportation availability, and also for the chronic conditions of the patient that results in increased likelihood of rehospitalization. A lot of the research studies that I did, they are taking into account the fact that there are some conditions such as COPD or heart failure where rehospitalization is something that's considered to be unavoidable because the condition is so severe. So I believe that CMS needs to take this into account when they're considering the factors that are causing these readmissions. The root causes can also be a direct result of social determinants of health, which is the neighborhood and the built environment, economic stability of the patient, their educational background, because as I said, the discharge paperwork can be very complex, and sometimes they don't understand it even when the nurse explains it to them as simply as they can. And then also social and community context, because they might not have access to the hospital because they might not have a clinic that's near them, and their primary care provider might be somewhere that's outside of their mileage. And then also another issue that I found is that with getting the medications from the pharmacy, sometimes there's difficulty getting them because our pharmacy closes, and if we have a late admission, we have to rush to get the medications, and there's also issues with that, and then lack of nearby pharmacies. So oftentimes our patients are getting discharged without their medications and being asked to follow up in their own pharmacy, so we have to verify if they have a pharmacy that's nearby so they can pick up their medications. And then equipment-wise, we're also waiting for walkers, toilet chairs, wound vacs, wheelchairs, and glucometers for our newly diagnosed diabetic patients. So there's a lot of different issues that are involved with these root cause analyses for hospital readmissions.